mornings on WCPT 820 Chicago's Progressive Talk, and in the afternoons on AM 950, the Progressive Voice of Minnesota. It is the Matt McNeil Show on your Friday. Good to have you with us. 952-946-6205, 952-946-6205. Leanne Hertzog-Donovan, I've known her for years and years and years. She is a pediatric ICU nurse at HCMC. I saw her about 2 weeks ago, and she was telling me about a project that she is involved with trying to help out the people of Rwanda. And so I said, I got to have you come on the air, especially when I found out that the funding to get there and do this really good work is not easy to come by. So I want to try to help out with that. And she is kind enough to not only come join us on the show, but she's being joined by Dr. Andrew Wu. He's a pediatric ICU attending at HCMC, Hennepin County Medical Center here in Minneapolis, St. Paul as well. And they're both kind enough today to join us to talk about the initiative that they're going through in Rwanda. Hi. Thank you very much. I appreciate the time, guys.
Hi, thank you.
Thanks for having us.
My pleasure. So, Leanne, let's start. You and I were talking. Rwanda apparently only has one pediatric ICU unit. Is that the case over there?
Yeah. So, I was trying to find out exactly how many pediatric hospitals or hospitals that had pediatrics inside of their hospitals. And I don't know, Andrew, do you know how many? I think I saw like 4 hospitals, but I'm pretty sure there's only one that has ICU capabilities.
Yeah, so there's 4 kind of higher resource hospitals in Rwanda. 3 of them are in the capital, Kigali, and one of them's up in Butaro, which is the hospital that we're working with. And the hospital that we're working with in Butaro is just starting their ICU, so that's what we're getting involved with. There are kind of ICU level care. There is ICU level care for pediatrics, I think, in Kigali and 1 or 2 of their hospitals, but I think that's about it. There is pediatric care outside of those hospitals, but they are more of kind of like there are fewer resource facilities and they're kind of more clinics as opposed to larger hospitals.
This is a very eye-opening thing, and people complain about what things we have here. Just off the top of your head, and I don't know if you know this, Doctor, how many pediatric ICU units are there in Minneapolis, St. Paul? How many hospitals have one?
Oh, gosh. Well, so there's one at the university, there's one at HCMC. Children's has one in each site, so at least there's 4 right there.
Gillette.
And that's just within, what's that?
Gillette.
And then Gillette too, so you have 5. And then our ICU beds, usually per unit, there's at least like Hennepin has 9, and the U has close to 20. Yeah. Whereas the ICU we're working with has 4.
Yes.
And those are going to adults and kids, so it's not just kids. So really, it's kind of 2 if you want to divide even.
And I want to put it in perspective for people out there. The Chicago as well. I'm presuming you have at least 10 of these units in your fine metro area. Rwanda is a country of 13 million people, I believe it is, and they have currently one pediatric ICU unit, and this is the one you're working with right now. You're trying to get up and going. It has only 4 beds, and it's also dealing with adults. So it's kind of one of those things where to say that there's a need is probably one of the largest understatements you could say. I mean, it's basically, for the size of the population, it's pretty much almost a non-existent option.
And to add to that, Matt, there is one formally trained pediatric ICU doctor in the whole country.
In the entire country?
In the whole country. He wasn't even trained in Rwanda. He was actually trained, oh gosh, I'm going to feel bad if I say this wrong, but I believe in Kenya, one of the neighboring sub-Saharan African countries.
How did you guys hear about this? How did you hear about this complete lack of basic care within a country?
What, Leanne, do you want me to start since I kind of got you in, or?
Yeah, because so Dave was kind of telling me a little bit about it before. I can start and then you can correct me if I'm wrong.
Yeah, for sure.
But so there's an organization called Global Perm NW, and they have done outreach in Ethiopia, and they started making some connections with Rwanda, and I guess through who they were speaking with there, they found out that there was a need also for pediatrics. Well, the physician that I'm speaking of from Global Perm, he is adult only medical ICU, And so he didn't know anybody at all in pediatrics. So he reached out to one of his colleagues, and that colleague had just recently moved to Minnesota and works at the University of Minnesota. So that person reached out to the pediatric ICU attending and I think medical director at the university, Gwen, and she got in contact with Andrew. And then Andrew asked our nurse manager if there was anyone that wanted to help.
How many people total are planning on going over there right now?
From our group,
Yeah.
or total?
Yeah, from your group.
So Leanne, so 2 nurses and 2 physicians from our group.
All right.
Yeah.
And I have to imagine. I mean, you're doctor. You are working in a fairly advanced medical environment here. Talk a little bit about your choice to kind of throw yourself into a world where you basically it's building a unit as you're going here. I mean, that's got to be. I mean, to a point, it must be extremely exciting, but at the same time, it's very intimidating.
Yes, extremely intimidating. I will say what is helpful is that I've actually been to the hospital before. The hospital works closely with a university also in the same town, Butaro, called the University of Global Health Equity, which has been built up by many international partners. One of the major international players that helped build up that university is basically Harvard Medical School. And I was fortunate enough to go to part of my training was over there, was over within the Harvard program. And so that's how I got to know the Rwanda site before. So all that to say is that a couple of years ago, I was actually at that site. So that kind of helps as well. But yes, you bring up a good point, is that it's quite a daunting task. And in that country, within their system, it's relatively, I shouldn't say unprecedented, but within their country and within that system, it's something new, right? It's going to be a new sort of environment that we're going to be exploring. But there's a lot of people who want to help out. And the fact that it's really nice that Dave has kind of paved a way from Global Perm. Their team has kind of paved the way for the adult side. So really on the ped side, I feel like we have the easy job where we just kind of see what they're doing and then make the pediatric version of it. But really we're obviously we're partners and moving forward together on it too. So.
Leanne, as a nurse, one of the things that you and I were talking about is there's an entirely different mentality you have to take when you get there. That what you take for granted when you have a cart, when you have the instructions, all these things, that you have to be prepared that basically this is going to, it is a building from scratch sort of thing. And even things such as basic manuals are going to be difficult to make sure that you have stocked and they're ready to go there, correct?
Correct. So we have been working for many months on creating policies and writing education for them. And we don't know exactly what they have until we get there. So for example, we're going to be teaching them a lot of skills that they're going to need to know how to do. And something as simple as placing an IV, putting a Foley catheter in somebody. And then, it could be up to like intubating patients. So there's a wide range of things that they don't know how to do. Also, over there, they have pharmacists to a certain extent, but we're going to have to be teaching them how to mix up medications and teaching them how to use IV pumps because they don't currently use IV pumps on the regular ward, is what I was just on a call before I hopped on this call, and I just learned that. So I'm going to be helping teach them how to use the IV pumps, but we're also having skills sessions where we are teaching them how to mix up the drugs and make sure that they're double checking it with someone so that they're not doing it incorrectly and accidentally harming somebody. It's a wide range of things and skills that we have to teach them. They also don't have respiratory therapists there. So the nurse is going to be in charge of setting up the ventilators and running the ventilators and doing everything. So the nurse there is actually even formula, they have to mix up formula. So they're nutrition, they're the nurse, they're the respiratory therapist. They're kind of running everything. And so for a hospital who has not ever had an ICU setting, this is quite a lot of information that we're going to have to be teaching them. And we are going to be making more trips in the future, like following up. So we're not just going one time and teaching, we are following up. And through the university, they also have set up a course where the people from Portland have been conversing with, I'll call them students, but the nurses over there, and kind of getting feedback on different materials that they've been sending them to read and their clinical experiences that they're having there. So I've been helping a little bit with that too.
This is something, and Doctor, I'll have you chime in on this. We live in a comfortable world, and there's a tendency for us to not want to look past our own borders here, even just in our metro areas, and say, hey, we're fine here. I don't have to worry about this. The reality is that we have a lot of the world that we need to play catch up on and get to the level of basic medical care that they deserve, they have a right to. And talk a little bit about this, because I think for a lot of people, this is probably the first time they're hearing, wait a second, there's one ICU pediatric ICU unit in Rwanda. That doesn't make any sense. Of course, we need to do better here. Talk about this, because I think there's an element of addressing this issue that needs to, we obviously need to come to grips with here too.
Yeah, absolutely. When it comes to pediatric health, so just child health in general, so kids die from all over the world due to various things. But if you look at the causes of death in kids under 5, this is data that's been in the literature and the research for like a decade or two. A lot of those deaths come from preventable things. So pneumonia, diarrhea, things that we have antibiotics, medicines for, things where if nutrition was better, we would be able to prevent a lot of these deaths in these young kids. And a lot of these deaths are also due to poor prenatal care. So a lot of them are things that we can address, but by we, I mean kind of higher resource settings, right? And so if you look at where these deaths occur, they're mostly happening in sub-Saharan Africa and Southeast Asia, predominantly in places where there are lower resources. And so a lot of people, if you talk to people who do this sort of work as part of their career, right, where they go to lower resource settings and try to help out, and from a health perspective, health and medicine perspective, there's a lot of different reasons why people go. And I think, Matt, I'm really glad you brought up this question, because I think there are, and I'm just speaking for myself, but I do think there are wrong reasons and right reasons for going. Mm-hmm. Historically, there's been this, the reason for going has been kind of like almost like a savior syndrome that people have, where they kind of come in, they help out, and then they leave. And then over time, unfortunately, these lower resource settings become really dependent on these higher resourced folks. And then it's even to the point where it just kind of broaches like a colonialist sort of approach. Sorry, I'm kind of digressing a little bit, but basically, to get to your question, yes, there is a big need for this. And I'm hoping that as people kind of look into this more, or if they're interested in it, that they're more interested in kind of building up the capacity that's there and empowering the people that are there, and then giving them the tools that they need to really kind of like help their own people.
Leanne, what's we got about 30 seconds here. What is the website? If people want to make a donation to help you guys get over there, where do they do that at?
It's globalpermnw.org. So globalpermnw.org.
I'll make sure I link to everything a little bit later on. Look for the links on social media and make a donation to help out, because obviously these guys are going over there and doing a lot of good work and starting a very good process, but it's expensive, and a lot of it's out of pocket. So let's try to get as much money as we can to help these guys out. Leanne Hertzog-Donovan and Dr. Andrea Wu, all my best. Travel safe. Thank you very much. I appreciate the time today.
Thank you so much.
Take care. We'll take a break. Come back. It's the Matt McNeil Show.
Say it to my face, don't run around.